It may come as a surprise, but countless seniors unknowingly worsen their sciatic pain by doing the wrong exercises or doing the right ones the wrong way. In fact, a peer-reviewed study in the Journal of Orthopedic and Sports Physical Therapy found that improper stretching and strengthening routines led to a 39% increase in pain symptoms in adults over 60 within just 6 weeks. The worst part? Many of these individuals believed they were doing age-appropriate, gentle movements. As a physician specializing in musculoskeletal and geriatric care, I've seen this mistake far too often. Patients mean well, but without targeted knowledge, their routines may aggravate, rather than ease, their condition. Sciatica isn't just an occasional discomfort. It's a warning sign, a signal that something is compressing the body's largest nerve, which runs from the lower back, through the hips, and all the way down the leg. That something could be a herniated disc, spinal stenosis, or a tight piriformis muscle deep in the buttocks. And as we age, these issues become even more problematic. Discs naturally lose hydration and elasticity, making them more prone to bulging. The core and gluteal muscles, which are responsible for stabilizing the spine, weaken if they're not actively maintained. Meanwhile, pain-induced inactivity compounds the issue, leading to stiffer joints, slower reflexes, and a higher risk of falls. Even more concerning, chronic sciatic pain has been linked to cognitive decline, disrupted sleep, and depressed mood. A trifecta no senior should ever have to battle. But here's the good news. Relief is absolutely possible. And it doesn't require surgery, injections, or painkillers. What you need are safe, doctor-recommended movements designed to address the root cause, gently and effectively. These exercises are not about pushing through pain. They're about decompressing the spine, loosening overly tight hips, and reactivating the deep postural muscles that many older adults stop using. They're suitable for people dealing with arthritis, limited range of motion, or general deconditioning. Best of all, they can be done right at home, with no equipment needed besides a chair and a mat. You'll learn how to properly stretch the piriformis without straining your lower back, how to strengthen your glutes to take pressure off the sciatic nerve, and how to improve your posture so your spine stays aligned, not compressed. These moves, when performed consistently, don't just mask the pain. They correct the imbalance that causes it. I've seen seniors who could barely stand up straight walk more freely after just a few weeks. And in the next section, I'll share the most overlooked muscle that contributes to sciatic pain in older adults and exactly how to stretch it for maximum relief. So if you're tired of limping, wincing, or avoiding the stairs, stick with me. You're about to learn a sequence that could transform how you move every single morning. Let's get to the root of the problem and fix it the right way. Sciatica can be one of the most debilitating issues seniors face, yet with proper movement, relief is not only possible, it's scientifically supported. In this comprehensive routine, we'll walk through 5 doctor-recommended exercises designed specifically for older adults experiencing sciatic nerve pain. These exercises don't just mask discomfort. They target the root causes, from spinal compression to piriformis tension and muscular weakness. Each one is scalable, safe, and supported by clinical insight. So you can start gently, adjust to your comfort, and improve mobility at your own pace. Let's begin with the standing back extensions, especially beneficial for those with herniated or bulging discs. In seniors, disc dehydration is common, making the spine more susceptible to compression. This gentle movement, performed by standing upright, placing your thumbs beside your spine, and leaning backward, helps shift disc material away from the nerve. That process is called centralization. Hold the position for 30 seconds and repeat it 5 times daily for potential immediate relief. But be cautious. If pain radiates further down the leg, stop. That might indicate increased nerve impingement. Next, we introduce the wall lean, ideal for unilateral pain, especially pain that worsens after sitting for long periods. Position yourself sideways near a wall, with your pain-free side closest to it. Gently press your opposite hip into the wall, using your hand. This helps realign the spine and push disc material away from the compressed side. Hold for 30 seconds. Repeat 3 to 5 times daily, and step further from the wall for added depth if comfortable. For many seniors with scoliosis or asymmetrical degeneration, this can be a game changer. The third exercise is the standing puppy pose, inspired by yoga, but simplified for older adults. Facing a wall, raise your arms overhead. Place your palms flat and slowly squat backward, imagining you're sitting into a chair. This decompresses the lumbar spine and stretches tight lower back muscles. A 30-second hold, repeated several times a day, can relieve spinal stenosis, a condition where the spinal canal narrows with age, compressing nerves. Want deeper release? Add a gentle lateral sway of your hips to loosen fascia and small muscles around the spine. Our fourth move, the figure 4 stretch, targets the piriformis muscle. In many seniors, this deep gluteal muscle becomes tight from years of sitting, compressing the sciatic nerve. Start by lying on your back. Cross one ankle over the opposite knee and gently slide the supporting leg toward your hips. Instead of pulling with your hands, focus on pressing the bent knee outward to activate the piriformis stretch. Hold for 5 seconds, repeating 10 to 15 times per side. Many seniors report near-instant relief with this one, especially if their pain originates in the buttock and travels down the thigh. Lastly, we move to glute bridges, a cornerstone in preventing sciatic flare-ups long-term. Weak glutes shift the burden of movement to the lower back, accelerating degeneration and nerve compression. To begin, lie flat on your back, knees bent, feet flat. Squeeze your glutes, lift your hips until your body forms a straight line from shoulders to knees, and hold for 5 seconds. Perform 5 to 10 repetitions and focus on form, not height. You're not trying to arch. You're trying to engage the hips and hamstrings in a controlled, steady lift. These exercises don't just treat the structures contributing to sciatic nerve pain. They rebuild your foundation from the inside out. Regular practice activates key muscle groups, improves circulation, boosts joint lubrication, and even enhances neurological coordination. The glutes, hip rotators, and spinal stabilizers all get attention, meaning you're not just treating pain, you're preventing future episodes. Beyond the physical relief, there's a deeper benefit: restoring your confidence. Pain limits more than movement. It limits independence, mood, and even cognition. Studies show that older adults who reduce pain through movement experience better sleep, improved memory, and lower rates of depression. That's because movement triggers the release of BDNF, a brain chemical essential for neuroplasticity and cognitive resilience. So how should seniors use these 5 moves? Ideally, cycle through them each morning or evening. Don't rush. Use a timer. Play calming music. This isn't just physical therapy. It's a ritual of self-respect. Start with 1 round per day and increase as you feel stronger. Keep a journal of your progress. How long you held each move. Which ones brought the most relief. What time of day works best. And here's one final tip. Always pair these routines with deep breathing. Controlled exhalations help calm the nervous system, reduce pain sensitivity, and oxygenate your tissues. Inhale through the nose for 4 seconds. Exhale through the mouth for 6. Do this before, during, or after each stretch. In conclusion, these 5 doctor-recommended sciatica exercises aren't just therapeutic, they're transformative. With consistent practice, you'll not only reduce pain, but reclaim your strength, your posture, and your peace of mind. You'll walk taller, sleep deeper, and face your day with greater ease. So now it's your turn. Which of these stretches gave you the most relief? Drop a comment below. I'd love to hear your experience. And don't forget to subscribe for more expert guidance on aging actively, aging wisely, and aging well. Ignoring sciatica might seem harmless at first. A dull ache down the back of your leg, some tingling when you sit too long, or that familiar tightness in your lower back when you get out of bed. But let me be clear, if you dismiss these early warning signs, you may be setting yourself up for far more than discomfort. Left untreated, sciatica can escalate into a serious, even life-altering condition. As a physician with decades of experience in treating aging adults, I've seen firsthand how something that starts as a manageable nuisance can evolve into permanent nerve damage. And when nerves are damaged, it's not just about pain anymore. It's about losing function. You may begin to experience muscle wasting in the legs, decreased coordination, and in severe cases, loss of bladder or bowel control, also known as incontinence. These are the moments when a simple walk across the room becomes a challenge, when once normal routines, like climbing stairs or getting in and out of the car, require assistance. And for many, that's the point where independence starts to slip away. What's even more sobering is how this kind of chronic pain can silently erode your quality of life. Poor sleep, irritability, loss of appetite, even cognitive decline have all been linked to prolonged pain conditions like sciatica. The body remains in a stress state, triggering inflammatory responses that affect your joints, your heart, and yes, even your brain. That's why I urge you, don't wait for the pain to get worse. Take action today. You've now learned several safe, doctor-approved exercises tailored specifically for seniors, movements that are gentle, effective, and can be done right from your living room, without equipment, without trainers, and without risk of injury. Now, I want to hear from you. Which of these exercises gave you the most relief? Was it the figure 4 stretch that unlocked tension in your hips? Or perhaps the gentle standing back extensions that helped decompress your spine after a restless night? Or maybe you've already been on this journey, battling sciatic pain after the age of 60, and you have a story to share. Drop your thoughts in the comments below. Let your experience be the encouragement someone else needs to finally take control of their health. And if you found today's information helpful, don't forget to give it a thumbs up, subscribe, and turn on the notification bell. Every week, I release practical, evidence-based guidance on how seniors can stay strong, mobile, and independent well into their 70s, 80s, and beyond. Because aging doesn't have to mean suffering. Not when you have the right knowledge and the support of a community that cares. Let's keep moving forward, stronger, smarter, and pain-free together.